I'm going to provide a brief overview of the youth risk behavior surveillance system. I'm going to kind of delve into key data from the 2021 National YRBS, and then I'm going to talk about the critical role that schools play in promoting adolescent health and well-being in light of these findings. Next slide, please. So I'm sure many of you already know, but the youth risk behavior surveillance system is actually a system of school-based surveys which make up the largest public health surveillance system in the United States, dedicated to monitoring a broad array of health-related behaviors and experiences among high school students. It surveys approximately 400,000 students across the country per cycle. And since its inception, approximately 4.9 million high school students across the country have participated in the YRBSS. The YRBSS is made up of a nationally representative school-based survey conducted by CDC, referred to as the National YRBS, and then state, territorial, tribal, and local surveys conducted by education and health agencies and tribal governments with support and technical assistance from CDC, but run and ultimately owned by those jurisdictions. And together, these surveys help monitor changes in adolescent health and well-being over time and identify and address emerging issues. Next slide, please. So, next slide, there we go. So since the national, state, and local questionnaires are generally distinct, I wanted to provide a few more details on how the questionnaires are developed. So the national YRBS consists of the standard questionnaire plus a set of 10 to 15 questions used to examine new and emerging health issues. These questions usually reflect emerging areas of interest for CDC and partners. So for instance, new and emerging topic areas in 2021 included a question on school connectedness and a question on unstable housing. In the 2023 YRBS, they'll include a gender identity question, experiences with racism, and adverse childhood experiences, as well as food insecurity. All participants in the state, local, territorial, and tribal surveys are required to use 2/3 of the questions in that standard questionnaire, but then have discretion as to what 2/3 they choose to include. And then they can also add questions from an extensive optional question list or add questions of their choosing, as long as they adhere to specific scientific parameters. And that what this does is it really provides flexibility to state and locals to capture data on the most important issues for young people and their jurisdictions. Next slide, please. So overall, we monitor kind of broadly these topic areas. And the YRBSS was established in 1990 to kind of look across all of these areas, including unintentional injuries and violence, sexual behaviors, mental health and suicide, substance use, obesity, dietary behaviors, and physical activity, as well as some other health topics. By administering YRBS, states and locals are better able to understand and monitor changes in these critical areas of adolescent health and well-being. Next slide, please. And as I mentioned, YRBSS is also extremely valuable in its ability to be adapted to ensure that it is effectively collecting data on the most important issues related to today's adolescents, while maintaining its ability to track adolescent behaviors and experiences over time. So here, as I mentioned before, these are some new and emerging topics that have either been added recently or will be added in the future to increase our understanding of these key areas. Next slide, please. So YRBS has been and really will continue to be one of the most critical tools in understanding the challenges facing young people. And the first step in developing solutions to these challenges is to understand them as best we can. I'm going to walk through a recent report released by CDC, which highlights and helps to communicate important trends in the health and well-being of our nation's young people as an example of kind of how we do that. Next slide, please. So in February, CDC released the 2021 Youth Risk Behavior Survey Data Summary and Trends Report. We have been producing this report for the last 3 cycles of YRBS. We did it in relation to the 2017 survey, the 2019 survey, and now for 2021. And what we do in this report is to provide kind of an overview of the data for that year, so in this case for 2021, but really take a 10-year look. So that, knowing that we have 30 years of data for some of these variables, really kind of looking at the most recent data, the most recent trends to kind of get a sense of how young people are doing. We focus on the 4 key areas that are important to DASH's work programmatically, including sexual behavior, substance use, experience of violence, and mental health and suicidal thoughts and behaviors. So that's not all of the data, and certainly not all of the data in some of these categories that are collected as part of the YRBS. But the things that we know, for instance, that our What Works in program has the most impact on. And so these are the things that for DASH are the things that we monitor over time. Each section, and this report is meant to be graphically useful and interesting, as opposed to just kind of tables of data. In each section, data are presented by sex, race, ethnicity, sexual identity, and sex-to-sex contacts. I do want to point out that the 2021 data are the first YRBS data collected since the start of the pandemic. Some of you may be familiar with our adolescent behaviors and experiences surveys, which was different than the YRBS in that although it was a sample of high school students, that data was collected online. So young people rather than being in their classroom, filled out the questionnaire online. And we did this because we knew that in the spring of 2021, there were still many young people who were receiving education virtually. And so we wanted to do a check-in and see how they were doing, but needed to do something that was methodologically distinct. So this data, which was collected in the fall of 2021, when almost all young people were back in their classrooms, is really the first traditional YRBS data collected since the start of the pandemic. And what we see here in the 2021 data kind of overall is that many of the same behaviors and experiences that were moving in the wrong direction prior to the pandemic continue to worsen. And this is particularly true for female students and LGBTQ+ students, especially in their experiences of violence and poor mental health. In the presenting some of this data, I'll provide some high-level overviews of adolescent health and then spend the bulk of my time delving into those 2 areas more. In addition to highlighting disparities by sexual identity, I'll walk through disparities by sex and by race ethnicity to provide kind of a more comprehensive picture. So I just do want to note, however, that because the 2021 National YRBS did not have a question assessing gender identity, the report does not highlight data specifically on students who identify as transgender or non-binary. Therefore, the T that's commonly used in the acronym LGBTQ+ is not included in the presentation of the data. So we refer to the students in this survey as LGBTQ+. For future versions of the National YRBS, we'll include a question on gender identity, and we're really looking forward to being able to understand those young people better. Next slide, please. So before turning to the data, I'd like to orient you to the charts that you're going to see throughout the presentation. As we walk through these charts, a red symbol on that right-hand side means that across the 10 years, or for however much data we have, the trend is moving in the wrong direction. If the icon on the right-hand side is green, it means the data is moving in the right direction. And if it's yellow, which there isn't one on this chart, but you'll see one soon, that means there is no statistically significant change in the data over time. So here you can see that sexual risk behaviors have been decreasing over the past decade, but so have preventive behaviors. So the percentage of students who ever had sex, who had 4 or more lifetime sexual partners, and who were currently sexually active have decreased between 2011 and 2021 statistically significantly, but there were also concerning decreases in condom use, HIV testing, and STD testing. For some of those declines, particularly the decline from 2019 to 2021 in STD testing, we need to better understand how much of the decline may have been impacted by services being less available during the pandemic. And you'll see this a couple of times in the data, that when there is a change from 2019 to 2021, so something stayed flat for a long time and then suddenly changed between 2019 and 2021, we have to try to understand the impact of the pandemic, since the 2019 data was before the pandemic, and and 2021 was kind of current, was still in the pandemic, but where young people's lives had kind of gotten back to a little bit more normal. Next slide, please. So in terms of substance use, generally we see improvements in several of the substance use variables included in the report over the years that they were collected. However, many students still use substances, and the lack of progress in adolescents' use of some substances is still concerning. In 2021, LGBTQ+ students were more likely than their heterosexual peers to engage in every substance use, with some significant disparities between these two groups. And we saw similar disparities between adolescent females and males. Next slide, please. So LGBTQ+ youth were more likely to use the most common substances. So for instance, LGBTQ+ students were more likely than their heterosexual peers to use more commonly used substances, including marijuana and alcohol. So 22% of LGBTQ+ students currently use marijuana compared to 14% of their heterosexual peers. Similarly, 26% of LGBTQ+ students currently drank alcohol compared to 22% of their heterosexual peers. Next slide, please. They were also more likely to use what we call high-risk substances, and that included 21% of LGBTQ+ students had ever used some of a select set of illicit drugs, including cocaine, heroin, methamphetamines, inhalant hallucinogens, or ecstasy, compared to 11% of heterosexual youth. And 11% of LGBTQ+ students were currently misusing prescription opioids compared to 4% of their heterosexual peers. We see similar disparities between male and female students. Female students were more likely than male students to engage in every type of substance use behavior included in our report. Next slide, please. In terms of experiences of violence, although experiences of bullying at school decreased from 2011 to 2021, all other experiences of violence either increased or didn't change. And within these overall trends, again, we see substantial disparities for LGBTQ+ students and female students. And there were also some disparities by race ethnicity. I do want to point out the decrease between 2019 and 2021 in the percent of students who were bullied at school may certainly have been because this question is reflective of the last year. So the question is, were you bullied in the last year? Were you bullied at school? And so we may be seeing that decrease because in the course of that last year at school, given that these data were collected in the fall of 2021, may have included significant periods of time when young people weren't at school. And so we're going to need to look at the 2023 data to see whether this was a blip due to the COVID pandemic. Next slide, please. And so what we see here is some of the disparities that we saw by race, ethnicity, and sex and sexual identity in students' experiences of violence. Black and Hispanic students were significantly more likely than Asian, white, and multiracial students to not go to school because of safety concerns. And I apologize, the formatting of this slide seems to have been corrupted in translation. So I will just point out to you some of the percentages. So for instance, 13% of American Indian Alaska Native students said that they had been missed school due to safety concerns. 5% of Asian students, 12% of Black students, 11% of Hispanic students, 8% of Native Hawaiian or Pacific Islander students, 7% of white students, and 8% of multiracial students. And so although the percent of American Indian Alaska Native students was higher because these were pairwise comparisons for each group, some of the small sample sizes in some of the groups, so for instance, American Indian Alaska Native or Native Hawaiian Pacific Islander students, some prevalence estimates may look larger, but were not statistically significant. Female students are also experiencing substantial sexual violence. And so in 2021, 14% of female students said that they had been physically forced to have sex when they did not want to in their lifetime. And 18% said that they had experienced some form of sexual violence, from inappropriate touching to forced sex, at some point in the past year. You know, since 2011, the forced sex variables have been too high, but have been stable somewhere between 10 and 12%. However, between 2019 and 2021, we saw a significant increase from 11% to 14%. And so we're still trying to understand why, after having seen no change, although still very high proportions of young people, particularly girls who said that they'd experienced forced sex, why we saw that increase between 2019 and 2021, we don't yet understand. In 2021, LGBTQ plus youth experienced more violence than their heterosexual peers. LGBTQ plus students were about 2 times as likely as their heterosexual peers to be electronically bullied, and almost 2 times as likely to miss school because of safety concerns at or on their way to school. And there you can't see the numbers because the slide corrupted, but 27% of LGBTQ plus students experienced electronic bullying, compared to 13% of heterosexual students, and 14% of LGBTQ plus students missed school due to safety concerns, compared to 7% of heterosexual students. Next slide, please. Nearly all indicators of poor mental health and suicidal thoughts and behaviors increased between 2011 and 2021, with nearly 30% of young people experiencing poor mental health in the past 30 days and 10% attempting suicide in the past year. And here again, we saw striking disparities in the proportion of female students and LGBTQ plus students having these experiences compared to their peers. Next slide, please. So first, I want to acknowledge I've been talking about groups of students as distinct by sexual identity, by sex and race, by race, ethnicity. But I want to be clear here, no group of young people are doing well in terms of mental health. And there are intersections between each of these identities. And so although we don't highlight the data by these intersections in the report, highlighting disparities by these groups can help us better understand the next questions to help us assess differences by various identities. So, you know, when we say that 42% in total of the students experienced depressive symptoms in the last year, most young people are somewhere between, you know, low 30s and 40s, except for LGBTQ plus students. 70% of LGBTQ plus students and 57% of female students said that they experienced depressive symptoms in the last year. So we're highlighting those groups because they are extremely high. But I do want to reiterate that no group of students is doing particularly well in terms of mental health. Next slide, please. The disparities between in depressive symptoms between male and female students is significant and increasing. And so when we look at the 10-year trends in persistent sadness or hopelessness among male and female students, we see that although both groups are experiencing increases in these symptoms of depression, the disparity has widened over the past decade. Next slide, please.
We are not.
Hi.
Pardon?
Who's ever talking? Could you go ahead and mute, please?
Right, and yes, we were open this morning, but because of the library that's associated open being closed by the county, we are closed. You're welcome.
I'm not sure if somebody can. Hi, Mr. Keston, could you mute?
Robert, please mute.
I'm trying.
So what we see in the data is that depressive symptoms increased among all racial and ethnic groups. And I apologize for how crowded this slide is, but basically all groups of young people saw increases in depressive symptoms over time. Next slide, please. We also saw that female students and LGBTQ plus students were more likely to attempt suicide in the last year. So 13% of female students compared to 7% of male students attempted suicide. 22% of LGBTQ plus students attempted suicide compared to 6% of heterosexual students. Next slide, please. And similarly, although we've seen this difference between male and female students over time, it increased in 2021. And actually, there was no statistically significant increase in attempted suicide among male students. Next slide, please. Here we see that, that both Black and white students experienced increases in suicide attempts. However, in 2021, Black students were more likely than Asian, Hispanic, and white students to attempt suicide. Next slide, please. So as I mentioned, we've added a new section in the report for this year, which includes data from 3 new questions that were added to the 2021 National YRDS. The new emerging national data section presents these 3 new variables, 2 questions assessing known protective factors, that is school connectedness and parental monitoring, and 1 question assessing a known social determinant of health, which is unstable housing. In 2021, almost 2/3 of students felt close to people at school or felt connected, that sense of school connectedness, but there were differences among students. So male students, heterosexual students, and white students were more likely to feel close to people at school compared to female students, LGBTQ plus students, and students from most other racial and ethnic groups, respectively. In terms of parental monitoring, students overwhelmingly, at 86%, said that their parents or other adults in their family most of the time or always knew where they were or who they were with. And in terms of unstable housing, while only 3% of students experienced unstable housing, some groups of students experienced it more than others, including American Indian or Alaskan Native students and Black students, who were more likely than students from other racial and ethnic groups to experience unstable housing. LGBTQ plus students were twice as likely to experience unstable housing than their heterosexual peers. Next slide, please. So, although there are many more findings that can be detailed within the report, it's about 90 pages long. There were 4 main things that I think were particularly striking across multiple variables. First, adolescent mental health continues to worsen. We saw this moving in the wrong direction prior to the pandemic. We understood that the pandemic had a negative impact on the mental health of young people, and we see that this continues. We also found that female students are experiencing substantially more violence, poor mental health, and suicidality. And it's not then surprising that they're also using more substances. And I think that's really leading us to look at substance use as an additional symptom of poor mental health rather than just a risk behavior. The disparities that we've previously seen between LGBTQ plus youth and heterosexual youth remain significant and extremely concerning. And when we look at the disparities between students from different racial and ethnic groups, although we don't see one group that is significantly higher than their peers across many variables, we do see important differences within each section that can help lead us to the most effective solution. Next slide, please. And so the data in this report, I think, are telling us this really profoundly impactful story about the level of trauma and distress that young people, particularly young women and particularly LGBTQ plus students, are experiencing right now. You are all here because you work on these issues every day. You're all invested in the health and well-being of young people and LGBTQ plus youth. The reasons that adolescents are experiencing this distress is complicated, but there really is something underlying that we know a lot about and we can do something about, and that is isolation and lack of connection. We know from our research that increasing connectedness to families, to communities, to schools improves all of the negative outcomes that we're seeing in this data. In the Division of Adolescent and School Health, we've been focused on increasing school connectedness because our research shows us that when young people feel like people in their school care about them, care about their well-being, care about their success, they do better, not just in school, but across their lifespan. So I'm going to spend a few minutes talking about the school-based program that we use and work with many of you in this virtual room to implement to address the concerns that we're seeing in the data. Next slide, please. So we know that schools provide a significant opportunity to reach adolescents and promote protective factors. Our What Works in Schools program, some of you know it is 1807, some of you knew it is 1308. We call it What Works in Schools, is an evidence-based primary prevention approach that supports local school districts in implementing 3 key strategies: improving health education, specifically sexual health education, connecting young people to the services they need, specifically and including sexual health services, and making school environments safer and more supportive so that youth feel connected and engaged. And by implementing these 3 strategies, schools can improve students' mental health, reduce substance use, sexual risk behavior, and experiences of violence. And we know that because when we've evaluated the program in the districts where we've implemented it, we see that it actually does lead to improvements across these outcomes. Next slide, please. We've seen in particular the power that creating safe and supportive school environments for young people can provide. Next slide, please. And so when schools put in place and enforce anti-harassment policies, increase parental engagement, increase school connectedness, and implement LGBTQ supportive policies and practices, we see that the proportion of students in that school who have ever had sex, who have had 4 or more lifetime partners, who are currently sexually active, all decrease. And those have been decreasing nationally, but we see for even further decrease in the schools where we work. But a couple of things that I want to point out: we have been seeing increases over time in the proportion of students nationally who miss school because of safety concerns, and an increase among female students in the proportion who have been physically forced to have sex. What we find is in the What Works in Schools program, when we put these practices in place, we actually see decreases in the proportion of students who miss school because of safety concerns and who have been physically forced to have sex. And we also see decreases in the proportion of students who use marijuana. And so what this tells us is that some of these kind of entrenched and difficult behaviors and experiences, when you do this work in schools, you are able to reverse those trends. And that does give us a sense of optimism on how to address some of the issues that we're seeing. Next slide, please. The program's evaluation has also shown that in the districts where we work, when schools make school environments safer and more supportive by implementing policies and practices designed to support LGBTQ+ youth, all youth have improved mental health and suicidal thoughts and behavior outcomes. So really, when you make schools less toxic for some youth by putting gender and sexuality alliances in place, by identifying safe spaces, by prohibiting harassment, and by providing professional development for educators on the importance of inclusivity, not only do you see improvements for students who identify as lesbian, gay, or bisexual, but you see improvements in these areas for students who identify as heterosexual. And the reverse is also true, that schools that don't put these policies and practices in place show poorer mental health and increased suicidal thoughts and behaviors among all students in the school. So that when you make schools less toxic for some youth, you make schools less toxic for all youth. So thank you for the work that you do. I know that it has been a difficult few years, and there is certainly more work to do. But these data show just how important it is to continue to support LGBTQ+ youth. Next slide, please. So I just want to leave you with a few resources that delve more deeply into these data to help support inclusivity in schools and to really help your schools move forward. Happy to take questions if that's possible in the virtual setting, but I again, I'm so sorry that the weather prevented all of us from being together and from me getting to Florida today, but really do want to thank you for the work that you do. And as I said, happy to answer any questions.
Hi, Dr. Ethier. It looks like we do have a few questions.
Okay.
One of them was from Lorraine Platek. She was asking, are the LGBTQ versus heterosexual data differences you are showing statistically different? In parentheses, she put, is the LGBTQ plus population sampled substantial?
So it is substantial enough that, okay, there's two things. One is that if we're talking about the evaluation data that showed that schools that had LGBTQ plus policies and LGBTQ plus policies and practices in place, yes, the sample size was sufficient to look at those differences. And in addition, if the question was about the youth risk behavior survey data that I presented, yes, the sample sizes are significant enough, are large enough to be able to show significance. That's why we actually group young people who identify as lesbian, gay, bisexual, or questioning, or unsure together, so that the sample size is substantial enough.
Great. So Esther Beers asking, would you consider, or why do you consider the percentage of youth ever having sex going down to be considered going in the right direction?
That's a really great question. And I think this is one of those variables that I think from an STD, HIV, teen pregnancy prevention, and when you look individually at the items, we classify it as not having yet had sex as being moving in a positive direction. But I do think that in the context of young people, kind of what's developmentally appropriate, I'm not sure that I would classify it that way. But from an HIV, STD, teen pregnancy prevention, that's how we classify it. But I completely take your point.
Esther was also curious what the purposes of saying physically forced to have sex versus sexual assault.
So the question is phrased, have you ever been physically forced to have sex when you did not want to? And so that is not the full definition of sexual assault, but it is also a very clear question that young people can recognize and answer. And so when we do cognitive testing on the questions that we include in the YRBS, we really need to have those questions be as specific as possible. And so that's why we ask the question that way. For the sexual violence by anyone question, we ask about a specific set of experiences that they might have had, but we've defined it in the question as sexual violence. And so we're trying to stay true to the question, the way that it's asked. You will often hear me when I talk kind of more generally about the data, I will refer to that forced sex question as rape, because that is or sexual assault, because that is a portion of what this represents. And so the young people who say that they have been physically forced to have sex when they did not want to have been sexually assaulted or have been raped, but it may actually be an underestimate, because there are other experiences that could count as rape or could count as sexual assault that are not included in that question. I hope that makes that somewhat clearer.
Okay. Chris Moore was just curious if everyone could get a copy of the second to last slide about increasing school safety for all students.
Sure, and we actually have a 2-pager on our website that we can make available that talks in more depth about those findings in case they're helpful.
Great. Diane Schneider asks, are students gender self-identified, or are they a result of school records? How can you be sure that someone who is quote unquote female in your survey is not a trans youth?
No, that's a great point. No, it is defined in the survey, and it's that way on purpose. I think when we, in the 23 data, as I mentioned, we will have a question that is, do you about gender identity. It's not the two-parter that sometimes you will see, which is what was your sex assigned at birth and what is your gender now. But it does allow students to talk about their gender identity. We will actually be able to compare those two. But I really do hope that when young people answer the question, they answer it in a way that is true to who they are.
Right. Next question's from Lorraine Playtech again, asking, do you think that the decline in using condoms is related to the decline in total number of students having sex?
No, because we only include in that question, we only include young people who have said that they have had sex. So it's specific to young people who are sexually active.
Diana Bruce asks, given these data points, are there resources for us to use to effectively push back on school policies that marginalize transgender students?
I hope that everything that we provide gives you what you need to be able to help your school districts support the policies and practices that are most important for the health and well-being of young people, particularly vulnerable LGBTQ youth. So if there are, please reach out and take a look at the resources that are available. If there are resources that you need, please feel free to let us know and we will see how we can connect you with them.
Booker Marshall asks, do you anticipate additional federal funding allocations to further support youth mental health in light of these data?
Yeah, so there has been a significant increase in resources that are available to school districts to support mental health work. I think what I would say, however, is that most of those resources are really targeted toward mental health services, which are obviously really important. I do worry that we are, kind of, as I say a lot, we're not going to be able to mental health professional our way out of where we are at this point, both because there just aren't enough services to help all young people, and not everyone needs mental health services. We can go really far by improving our school environments, and we've seen that by increasing school connectedness. That improving that sense of connection is going to ameliorate some of the impact of isolation and loneliness that we've been seeing over time and then was exacerbated during the pandemic. I am really happy to say that our What Works in Schools program was highlighted in the HHS Behavioral Health Transformation Roadmap and is in the president's budget for full scale up. So that would be an increase of $52 million, which would allow us to fund all 50 states and 75 of the largest local education agencies. Currently, we're in 28 large urban school districts. That would allow us to get to 75. And as well as providing technical assistance and training to any district in the country who wanted it. So, it's obviously it's the president's budget and there's a long way to go, but the administration has recognized that What Works in Schools is an important way to try to improve schools to support all young people.
So I have kind of a comment from Danielle King, just kind of back to the the sexual assault question. So they say physically forced to have sex is a tricky phrase because young people are manipulated and taken advantage of in different ways that may not look like physical force. I would hope in the future more expansive language is used across the board, such as have you ever engaged in sexual acts that you did not want to or did not consent to?
Yeah, so that's why we have kind of we've added questions over time. I believe there is an additional question that was included in 2023 that uses more expansive language. So I can try to find out what that is. But we agree that we have to ask these questions in a variety of different ways. One of the interesting things that we've found over time is that we've been seeing decreases in dating violence, but it's not clear that dating violence, both physical and sexual dating violence, have actually decreased overall in the entire population, but that the number of young people, we've been seeing the sample sizes of the number of young people who say they are dating, which is kind of the precursor to answering that question, has been going down. So I completely agree that we have to continue to adapt our questions in ways that are relevant to young people's experiences. And thank you for that suggestion. I will bring it back to our surveillance folks.
Diane Schneider says, as a sex educator, having sex has always been thought of as male-female intercourse. These leaves out our LGBTQ plus youth. Are you able to break down sexual intimacies to be more inclusive?
So we actually tried to leave that question as broad as possible for exactly that reason. But we also, it is very difficult for us in a school-based setting to ask more detailed questions about types of sexual behavior. And so we try to leave those questions, as I said, as broad as possible, and then do additional work to try to understand. So we've had several internet panel surveys that kind of give us a little bit more in-depth information. I agree. It is when you have these kind of broad single items, they can actually not be as reflective of young people's experiences as we would like them to be.
Could you just clarify about the exclusion of transgender in these studies? Lorraine was wondering why that wasn't included, or just like a general question about gender non-conforming folks.
So, you know, there is a question that has been used in a variety of states about gender non-conforming young people, and then there's a transgender identity question that has been used in a variety of states. I mean, I think as folks who have worked with the YRBS over time know that oftentimes what we do is we have encouraged states to use questions in their surveys, and we use that as kind of test cases for how to ask particular questions, and for when we see that enough young people are answering a question and answering it positively to make it then eligible or included in the standard survey, which means, you know, we use it in the national, and it is the option for all states and locals to use. So we used the over the last, I would say, I don't know, 4 or 5 cycles of the YRBS, increasing numbers of states have been using that transgender identity question in their state surveys. I believe that the one that we included in the 2023 standard survey is a variation of that survey that addressed, I think, some of the non-binary issues, because I think that the original question that was in the state survey was, do you identify as transgender, some version of that. And so we've tried to expand on that some. But again, because we can't currently at this time ask what was your gender at birth, what was your sex at birth? What is your gender identity now? We've had to kind of adjust that question some.
Great. And then our last question is from Charles Pratt. They're asking, when we look at the data from the CDC's last YRBS question about gender identity, do we expect that question to say the same? So related.
I think I just answered that. I think it will,
Yeah.
it's adjusted some to be more inclusive of non-binary youth.
Great. All right, thank you everyone for your questions. I'm gonna hand it over to our Executive Director, Robert Keston.
Thank you, Doctor, for really such amazing information. I think that some people can guess at it and some people imagine it, but when you see those disparities, it's alarming, and it has to make us wonder what else we can do in order to make the world a safer place for those who don't conform with the normal or what is assumed to be normal, since we're all normal just by the very nature of our being human beings, and human beings are so different. Thank you to the CDC for providing that information. The CDC does a remarkable job considering the constraints on it because of how states react to certain information, how some parents react to collecting certain information. So your task is not an easy one, yet every year it undoubtedly becomes more important. So thank you again for participating with us. Thank you for understanding the trials and tribulations of climate change that has put our city underwater, quite literally, at this time, and politically in an also difficult place to be for so many. I just want to remind people that Stonewall National Museum, Archives, and Library is here for everyone. We are not in any way discriminatory or exclusive. No matter who you are, no matter where you're from, you're always welcome here. Our archives, our library, our museum are for everyone to participate in. We want everybody's story to be represented in our collections. And we hope that you will enjoy Friday, Saturday, and Sunday. Friday's program has changed slightly, but it will still start at 8:30 tomorrow morning at the Courtyard by Marriott on Federal here in Fort Lauderdale. Hopefully some of the rain will have washed away and the streets will be visible so that they are passable. Saturday right now will be the same. Sunday will be the same. So we look forward to seeing as many of you as possible. We're not sure yet if Friday will be Zoomable, Saturday will be, and Sunday will be. So thank you all again for participating in this really interesting and mightily important session, a perfect way for us to kick off. Thank you all. Have a great afternoon, and we'll see you tomorrow morning.
Thank you.